2013 as National Fibromyalgia Awareness Day in Columbus, Ohio, and to raise awareness for fibromyalgia, a chronic pain disorder that is a major cause of disability and has no known cure. I'm just going to read some of the resolution. Whereas an estimated 10 million people in the United States, up to 8% of the population of our country, and millions of people worldwide have been diagnosed with fibromyalgia, a disease which has no known cause or cure. Whereas fibromyalgia is a condition affecting the central nervous system, a chronic illness increasing at an alarming rate that causes fatigue, debilitating pain in women, men, and children of all ethnicities. Whereas patients with illness often have to learn to live with widespread pain throughout their bodies, extreme fatigue, sleep disorders, stiffness, weakness, migraine headaches, numbness, tingling, impairment of memory and concentration. Whereas fibromyalgia is not only very common, but it's typically also very disabiliting. Up to 15 to 20% of fibromyalgia patients may be in long-term disability and fall into a high risk of suicide and accident-prone category of people. Whereas increased awareness and expanded knowledge of the realities of living with fibromyalgia and its impacts on patients' quality of life will allow the community at large to better support people who struggle with challenges of chronic pain and illness. And whereas Fibromyalgia Association is a nonprofit charitable organization and the publisher of Fibromyalgia Aware, the first and only consumer magazine for fibromyalgia. And whereas the National Fibromyalgia Association, Kevin Hackshaw, MD, Associate Professor of Medicine, Fellowship Director of Rheumatology at the Ohio State University College of Medicine, and Michelle Lee, host of Exceptions to the Rules radio show on Talktainment Radio, and suffers from fibromyalgia, and other groups around the country have joined together to promote fibromyalgia awareness and support, including improved education, diagnosis, research, and treatment. And whereas the National Fibromyalgia Association is urging fibromyalgia patients and their supporters, healthcare providers, and general public to demonstrate their caring by sharing the road their patients walk, the facts about this disease, and ever-growing awareness about the disorder and patient treatments. Whereas the community's focus on fibromyalgia and its impact on patients' lives will help guarantee hope for a better future for people with this disease. Be it ordained by the Council of the City of Columbus that we hereby recognize the needs of these chronically ill people and recognize May 12th of 2013 as Fibromyalgia Awareness Day in Columbus, Ohio. And we urge all citizens to support the search for cure and offer assistance to those individuals and families who deal with this devastating disease. I move to pass away.
Miller Mills, Kevin Tyson, President Gifford.
Thank you. Michelle, the floor is yours.
Good evening, Councilmember Priscilla Tyson, Chair of Health and Human Services Committee, President Gifford, members of City Council. I am E. Michelle Lee, founder and host of the Exceptions to the Rules radio show for entrepreneurs and small business owners here in Ohio and abroad on a local station, Talktainment Radio, and a regular business columnist for the Ohio MBE newspaper. I am a sufferer of fibromyalgia for more than 20 years and 19 surgeries later. I stand here before you today on behalf of those who are like me and that I advocate for to declare that we need better education with nutrition, exercise, and home motivation for those who suffer fibromyalgia and chronic pain here in our great city of Columbus. This proclamation for Fibromyalgia Awareness Day, May 12th, will help us to gain awareness and provide the kind of education and resources people need to overcome this neurological disease known as FNS. After having had 19 major surgeries, many of which were related to diseases found in the consensus of fibromyalgia patients living with this pain 24/7, 365 days a year, for more than 20 years without rhyme or reason, and with little or no help or hope from the medical community and or family, neighbors, and colleagues, I believe now is the time for me to stand and help be a part of the solution to helping others overcome this invisible disease that plagues their minds, bodies, and souls every waking minute of their day. Thank you again for the sense of urgency you understand to approve this proclamation in our great city of Columbus, for the unrecognized community of fibromyalgia, FMS sufferers. May 12th will be a day to learn, educate others, and establish a yearly expectation of keeping the general public updated and aware of new developments toward a cure for FMS. Resources will be available throughout the year and made possible with this proclamation. By enlisting the support of elected officials across the country, we ensure the steady growth of awareness. It is our hope that one day fibromyalgia will be a household word. We will no longer have to suffer indignities at the hands of callous employers or uninformed family members, or worse, the medical professionals. Like so many patient populations have before us, we will have gained the respect of the general public and the medical community. Therefore, we will be more likely to succeed in educating the public about this rapidly growing concern of the FMS disease and its effects on our residents in our communities. I have compiled years of recorded journaling, enlisted the support of OSU's Dr. Kevin Hackshaw, National Fibromyalgia Association, National Fibromyalgia and Chronic Pain Association, Victory Fitness Center, and a multitude of small and local business owners who suffer from FMS and or have a product or service that may help ease the pain of FMS so that we can be more productive citizens at home, work, and play. Exceptions Get Over It Challenge was created to educate, motivate, and provide resources to FMS and chronic pain sufferers, especially entrepreneurs and small business owners who do not have health insurance. We will travel throughout the city, state, and country to disseminate FMS education and attend public awareness events along with our partners NFA, NFMCPA, and OSU. This program will provide guidance for medical professionals, nutritionists, exercise certified and or degree trainers, and tons of motivational methods needed to withstand the effects and side effects of FMS. This program and many others rely upon our ability to promote awareness, having such credentials as a recognized day, citywide, statewide, and nationwide. Councilmember Tyson and Mr. Carr Williams, I want to especially thank you on behalf of all of us for seeing the urgency of this need to proclaim help and hope for those in pain. FMS destroys people, families, and economy, sometimes quickly and sometimes tirelessly in the most torturous of ways. I greatly appreciate and am humbled by what you are doing here today that will ensure awareness for FMS and its related diseases and need for understanding. The approval of this resolution to declare and decree that May 12th will hereinafter be recognized as Columbus City Fibromyalgia Awareness Day will enable those like me and my partners to educate others in finding compassion and a cure for FMS. I want to thank you from the bottom of my heart. Without the support and recognition of elected officials, the fibromyalgia community daily battle with pain and fatigue would go unnoticed. With an estimated 10 million Americans suffering from fibromyalgia, we are at a crossroads in research. We must strive to continually make health practitioners aware of our plight. It is only with this recognition that we will be able to be successful in securing research funds to pinpoint the causes of fibromyalgia and start towards finding a cure. With that said, I would like to now introduce you to one of our partners who will monitor and contribute to the overall success of this program, the Get Over It Challenge, and continue to help us carry the torch of hope for fibromyalgia awareness and its cure. May I introduce to you Dr. Kevin Hackshaw, MD, Associate Professor of Medicine, Fellowship Director, Rheumatology, The Ohio State University College of Medicine.
Good evening, Councilmember Tyson, President Ginter, and members of the City Council. I'm Dr. Kevin Hackshaw. I'm Associate Professor of Medicine at The Ohio State University, Fellowship Director. I've been at Ohio State University since 1990, and I'm here today having partnered with Ms. Michelle Lee, Exceptions to the Rules, the National Fibromyalgia Association, and others who become a collective group through the Exceptions Get Over It Challenge to help educate, motivate, and seek treatments for those suffering with fibromyalgia and chronic pain here in Columbus and Aurora. Our focus on research has been on better understanding the mechanisms involved in chronic pain propagation. Our research has been funded by local and national foundations aimed at understanding the underlying mechanisms that lead to chronic pain and then developing appropriate target treatment approaches towards the identified mechanisms. Most recently, we've been working on developing blood markers that are able to uniquely distinguish individuals with fibromyalgia from other conditions. I've been on the faculty at Ohio State since 1990, primary emphasis being on patient care and research. In this regard, I focused my research on the most common cause of chronic pain and disability seeking in the U.S., and that is fibromyalgia. Fibromyalgia affects up to 5% of the U.S. population, and in terms of healthcare utilization dollars, the costs per patient annually are equal or greater than the cost of care for individuals with other chronic conditions like, for example, rheumatoid arthritis. So fibromyalgia is the most frequently encountered disorder seen by primary care physicians, at least 10 to 25% of their practice, rheumatologists, 20 to 30% of their practice, and a whole host of other specialists. It's a frequent cause of individuals seeking disability due to inability to function maximally in the workplace. So it's my belief that this proclamation will help us to better educate the public, medical professionals, and those who suffer from fibromyalgia and its many ailments that are associated. Also, given current information, this proclamation recognizing May 12th as Columbus Fibromyalgia Awareness Day will help us also to seek out funding for OSU College of Medicine and continued commitment for research and diagnostic tools, improved treatment options, and other modalities that will lead to improvement of quality of life for all individuals affected. I'm pleased and honored to be a part of this day, part of the collective group for solutions and for this proclamation and its mission to help heal those who hurt and live in pain with fibromyalgia. Thank you, Councilmember Tyson, President Ginter, and members of council for your support and for the support of the efforts of this collective group and myself.
Thank you, Michelle Lee, and thank you, Dr. Hackshaw, for the work that you're doing. If an individual wants to get more information regarding fibromyalgia, who should they contact?
Just
On the line.
an email to michelle@prwithapurpose.com, or they can also tune into our show.
Okay.
All month long, we're having doctors from all over the world, and also all the associations mentioned today that will be disseminating education and also resources for those listeners and for the work that we're doing with Dr. Hackshaw.
Thank you so much, and thank you for coming down and certainly sharing the information about fibromyalgia, bringing that awareness to our listeners and to our viewers. And also, I'm so happy there's a partnership with the Ohio State University to be able to help more